Dr. Faid, can you come downstairs here? Dr. Faid? Right. Okay. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to introduce myself and Dr. Faid too. She is my wife and she is my partner. We've been together for more than 25 years now. And we are together in everything. And myself, my name is Mohamed Khallaf, and I am associate professor at the University of San Augustine. I have been a physical therapist for 25 years, yes. So this morning when I thought about it, I was like, is it 25 years? Yes, this September, it's 25 years. Today we're going to talk about the tech neck syndrome, which is a very trending topic. So everybody is using phones now. Everybody's using computers. And the correct way of using them would help us a lot. But of course, using it in a faulty way would lead a lot of problems. Today, we're going to focus on one of these problems. So before we move on, this is my family. I have 3 boys, and of course, Dr. Faid is my wife, and she's also assistant professor at the University of San Augustine. When you look at the picture, these are our families, right? Everybody's doing this. Everybody is just like on either their phones or computers. And all of them are having this kind of posture. So starting at the kids, at the elementary schools, they are forced to use computers. Sometimes we allow them to use the phones, even before this. Watching cartoons, watching movies, watching all this. So it's now part of our life. So we need to learn how to use them in the correct way. When I talk to my patient about this, one of them just said, "This is my default," being slouched forward. So it becomes a problem because now it's the default of the people to be like this. In our lecture today, we're going to talk about the consequences of having this faulty posture. Talking about the incidence of this thick neck syndrome, it's now getting higher and higher and higher. So when you look at the statistics there, it's scary. You look at the elementary schools, 35% of the kids having that neck pain problem. At the level of the high school, 50% of them, almost 50%, they would have that neck pain. Going up a little higher with the university students, it becomes like 73% of them having that pain. This is like really scaring. And then when it comes to the people who are working in the tech, working 8 hours a day behind their computers, it's going to be 64%. So it's a lot, right? And that needs us to have like Let's focus on this. Let's see how to solve this problem. When you look at the picture here, it becomes like a leash of us. People who have bits, they have leash for them to prevent them from doing a lot of stuff. But this is our leash now. We got this. Wherever we go, before the bedtime, when you wake up in the morning, right? So everybody's looking at his phone. And we don't think about what's going on there in the head, right? So it's really, really like a leash for us now. For this reason, I wanted to focus on what are the problems, what's going to happen after this. So if you use the computer or the cell phones in a faulty posture, so you're looking down a lot, prolonged periods of time. Take people working in 8 hours, right? So 8 hours are a lot for them. And then this would lead to basically flexion of the neck all the time we are bent down. And from there, that would increase the mechanical stresses on the neck muscles. Not only the neck muscles, the bone. Moreover, this would affect the receptors that are telling the brain what is the position of the head in space. Right? And then poor posture would result, incorrect body alignment, and this is when we got our default. So this is the default, and being straight, this is the weird position that we may, right? So all of this would lead to neck, shoulder, pain, stiffness, and then headaches would result after this. Also, we would have distorted functions of the respiratory and circulatory systems. We would have distorted function of the nervous system. And this one is the hardest to cure. So these are what is happening after prolonged time in a slouched posture. To understand this more, let's talk about what we have there in this neck area. First, we have the bones, right? So we have 7 vertebrae, small ones. The neck is mobile part, very mobile. So these bones need a support. The bone by themselves, when you put a compression force on them, it's going to be like 5 pounds weight, and they collapse. That's all. So the bone cannot take more than 5 pounds. But when the layers of the muscles are added to that, we can have 3 times more than the weight of the head when the muscles are kind of like mildly active. But if they are really active, they can take more than 23 times more than the weight of the head, which can be 1.7 of the total body weight. So imagine without the muscles, it's going to be collapse after 5 pounds. With the muscles, we got a lot of tolerance, but the problem is to what limit? So when you look at this kid, he's carrying something on his head, and this may be more than his body weight, correct? Anybody has sympathy for it? So when you look at the picture, oh, poor kid, he's carrying a lot, right? But this kid will be much better than you carrying the phone. Because as you do more flexion of the neck, the weight of the head is getting more and more and more. So if you do just a flexion of the head about 15 degrees, the weight of the head becomes tripled, so 27 pounds. The more the flexion, the more the weight of that. So if you got some sympathy for this kid, when you look at yourself, just carrying the phone, that's more than what he's carrying, because he's just carrying this for 10 minutes, 15 minutes, that's all. But you're doing this for 8 hours, maybe more, because after work, you're going to continue using your phone. And you're not aware about your posture, about your faulty posture. This is the problem here. So this is about the bones of the neck. What about the muscles? I'm not going to talk much about the muscles. I selected 4 muscles. 2 in front, 2 at the back. The first one here, it's called the sternomastoid muscle, which is this one. Whenever you look at the mirror in the morning and you see this muscle, it means something wrong. It should not be visible. So if you see them here at the roots of the neck, okay, there is something wrong here. These muscles, when they are getting tired, they may lead to headache, and this would be the case. You would feel the headache around the eyes. You would feel the headache at the back of the head. This muscle is one of those muscles of respiration, so it helps in respiration. Dr. Fay is going to talk about this in details, but this muscle is one of those that you can easily find out if there is a problem with that or not. Just look at the mirror in the morning, and if you see it again here, if you see it at the roots of the neck, it means something wrong. The other muscle. These muscles are on the side of the neck. They are called the scalene muscles. I see many engineers here. When you look at these, it's like wires supporting an antenna in the middle. So we have this in our body millions of years ago, right? But our engineers now, they have in the antenna supported by the wires, those bridges supported with the wires. So this is one of the miracles of our body. These muscles, if they are getting tight or getting weak, they may lead to a problem. The nerves that feed the upper extremity here, they are coming out in between 2 of those muscles. So if you wake up in the morning feeling like my neck hurt and I cannot move, this is because of a spasm of these muscles here. It's not only that. You can see here that there is an artery and a vein connected to this. So if you feel your hand numb, if you feel your hand weak, this means that this group of muscles, there are 3 groups, something wrong here. And you would feel the pain here. Look at the distribution there. It's all the way to the arm. Because these are the nerves that are feeding our arms, our muscles. The third group of muscles. Here they are small muscles at the base of the neck. These muscles, they are tiny. They are very small muscles. They are getting tight with this being in this position. These muscles, they have a very important function, which is what? They position our nose, our eyes, and our mouth in this good orientation. So the mouth is going to be horizontal, the nose is going to be vertical, and we can see and we have stabilized gaze. When you look at the signs in the street, you can read them. Look how tiny are they, but they are really important for our life. If you see the letters bouncy, there's something wrong here. These muscles are not supporting your head. The last group that I'm talking about today, which is the trapezius muscle here, and this is the long extensors of the neck. Look how big it is. This is the biggest one I'm talking about today. But when you have this posture for a long time, they are going to be weak, untied, and going to be causing this type of headache and pain. All right? So please, when you are sitting, just make sure that you are sitting straight. If you are slouching more, like this, the weight of the arms goes to this muscle, the trap, instead of going to the back. So imagine the weight of your arm is going to these four muscles. It should be going to the spine, and from the thoracic spine should be going to the lumbar and then to the sitting bone. And instead, you have the weight on these muscles. People who are working on a computer, having the mouse like this and the arm is hanging up, is not supported. You need to support the arm. Okay? So this will be the end result. We got what's called the upper cross syndrome and the lower cross syndrome. For the upper cross syndrome, here, tight, short neck extensors, those small muscles, we talked about them. You would have tight, long flexors, the SCM muscle, the one that I told you, if you look at the mirror and you see it, it means that there is something wrong there. You got weak, long extensors, which is the trap muscles. You got weak, deep flexors muscles. So this is the beginning. And this would extend more to include also the lower cross syndrome. So instead of having only neck pain, it's going to extend to the lower back, and you would have neck pain and lower back pain. This would result in weak abdominals, weak glutes, tight back extensors, tight hip flexors. This is the lower cross syndrome. This is how our body is connected. Once it starts up there, it's going to extend to the lower body too. All these are just consequences of being there. What do you think about this picture? So instead of being nice and tall and having really good shape, really good look, right? Now this is the case. Some kyphosis at the thoracic spine, increased lordotic curve of the lumbar spine, and look how you're going to be shorter. And if you continue doing this, this would be the end result. Having a hump, right? So the guy at that age is still working on a computer. So I want you to just stick an image in your mind to this picture to avoid what can happen. Now we're going to talk about a little bit about respiration and how this would affect how you breathe.
Okay, so thank you for the opportunity. Maybe I choose this part to talk about because my master's and PhD in cardiopulmonary and geriatric disorders. So that's why I just like to share my knowledge. What is the relation between the inspiratory muscles or the chest in general and the neck muscles? They are closely related to each other. So some researchers to believe that neck muscles may lead to associated changes in the thoracic spine and the rib cage, and also to do consecutive changes to the breathing pattern. So what is the breathing? Normally, it is the meaning of that you are alive, right? So what we know about breathing, there is air going inside and there's another air going outside. But actually, it's not that simple. It is a complex process, and maybe you unable to sense this because you are a normal person. But if you got some flu or some infection to your airways, you're going to feel this process so hard. It's hard to take your breathing normally. So here, what we say that the normal or the main muscle of inspiration is the diaphragm, which is in the abdominal area. But also we have the intercostals around the rib cage, and also we have the neck muscles as accessory muscles. So that means if we have any neck spasm or any neck problems, that means we will suffer from impaired breathing. So what to do?
So you have to keep it in such a way so that...
I can talk like this.
Can she have the headphones?
Like this? Okay, I can't hear myself. Hear me? Okay, no? Okay, so yes, okay, perfect. Okay, so yes, there is a correlation between the breathing pattern and your neck muscles. So breathing mainly is how we use our muscles to expand the lungs, use the diaphragm to move the rib cage. So when we need this, we need other muscles to help. The helper muscles here are the neck muscles. So if you have any neck spasm or chronic pains, that means we have impaired breathing. We have decrease in the lung volumes, we have decreased chest expansion, and also it's gonna affect the total spine. Here we can say, yes, the common function of the sternocleidomastoid, the trapezius, and the scalene muscles that Dr. Khallaf just mentioned, they are the accessory muscles of breathing, and when they get spasm, they're gonna affect the inspiration, and research has said that it's gonna decrease the lung volumes by more than 50%. Change in the curve and the muscle imbalance is also important, and if you know how the curve looks like, there's a cervical curve, and then the thoracic, and then the lumbar. So there is a close relation between the cervical curve and also the thoracic one. Okay. So since this, oh my God, this is totally different. Okay. So then there's a relation between two curves. So anything happen to the cervical curve will affect the thoracic one. The thoracic curve, which is closely attached to the ribs and the chest area. Segmental instability of the neck also might be observed in the thoracic spine because of the muscles that Dr. Khallaf mentioned, and also the longus colli muscles in both areas. So any impairment happen to the neck area will also impair the chest area. And also if we have a problem in the accessory respiratory muscles, that means it will affect your power of breathing. Give an example for this. If you are doing your workout, if you're walking so maybe like faster than your usual, you start taking like much rate or like higher rate of breath. So you're gonna do like, that means your breathing is shallow. If I want to make it effective, I need more deep breath. So deeper breath here means I'm using another muscles rather than the diaphragm, which are the neck muscles. So I'm using the neck muscles when I do need a much like effort or something like workout or like something more than the usual breathing, which is in and out, the simple in and out. So it's important to keep our neck muscles safe and healthy in order to breathe normally and deeper. Okay.
All right. So now it's the time to talk a little bit about how to prevent this, right? So this is the main thing. This is what you guys want to hear from us. So the first thing, let's start at the sleeping pattern. Let's start at the bed. First of all, the question that I ask a lot, are you side sleeper or back sleeper? So back sleepers first. The mattress. This is the environment. This is the surface that you would be on for 6 hours, maybe more. At least 6 hours, let's say so. So it has to be firm or extra firm mattress. The age of the mattress should not be more than 10 years. So the older ones are getting you back, getting your back, your neck, causing problems. Soft mattresses are disaster. So try to avoid this. You would feel the pain immediately when you wake up. Avoid sleeping flat. Many people, they come and say, okay, I have a small pillow or I have nothing. Being flat is a problem. Being flat increases the extension more than normal, which is painful for the people who has kind of degenerative joint diseases. And also, it narrows the exit of the nerve. So this may lead to pain and stiffness, especially when you wake up in the morning. One more thing. You all know that we have our vestibular system in the inner ear. This is one of the systems that help us maintain balance. I'm going to talk about it later. But for now, we have some crystals. These are our gyroscopes that tells us, okay, now we are moving forward. Now we're moving backward. When you are driving, when you hit the brake and the car stops, your head goes forward, right? These are the crystals inside the ear. If you lay flat for a long time, one of these crystals may be detached. And this will lead to one of the most awful experiences, according to the patients, is to see the room rotating for you. So this is the vertigo. So laying flat is one of those things that we tell our patients who got positional vertigo, avoid laying flat. Even I tell them we have to have the head up 30 degrees. You can sleep on a recliner for 48 hours. But not everybody has a recliner, right? So you have to elevate the bed kind of 30 degrees to avoid the positional vertigo. So never ever lay flat or with this very small pillow. Make sure you have your shoulder kind of relaxed, because this is part of the upper cross syndrome. So I want the gravity to take my muscles back, and I can lay relaxed on the bed. You can bend the knees a little bit to relax the lumbar spine. So I may have a pillow underneath my knee here. Just getting the knee bent kind of like 5 to 10 degrees would be enough. To relax the muscles of the hip, one of the muscles that we mentioned, it's going to be tight in the lower cross syndrome. So I want that muscle to be relaxed, so the lumbar spine is going to be relaxed too. The last one here, if you are one of those who like to read on a bed, make sure the light is coming from the top, not from the side. Right? But if you are a side sleeper, how many pillows? It doesn't matter. But what matters is this space. The pillow should have all that space filled in. Right? So here, I don't want my head to be bent down or stretched up. So it has to be neutral. One of the things about the neck veins and arteries is that these veins, they don't have valves. Everywhere in our body, we have valves. So the blood can be pushed towards the heart and don't go back. Neck doesn't have valves. So if you stay in this position for a long time, a congestion would happen in the vein. And the vein runs with an artery and vein and a nerve. So this would increase the problem and may lead to an ischemic pain. So avoid being there The head should be neutral all the time. Also for the shoulders. Shoulders are, many people now having rotator cuff issues, right? So we need to protect that part by getting the shoulder protracted a little bit when you sleep on that side. The knee can be bent a little bit, and you may have a pillow on between the knees. And avoid also spinal rotations. When you are sitting or driving, these are the best postures. For driving, especially ladies, look at this part. The head is forward. If you don't have your head rested on the neck constraint here, okay, don't go much forward. The seat can be moved forward, can be moved back, so adjust it. For the tech people, here are the best things. Best postures that you can use. If you have a standing desk, this is the best thing that you can invest in. So not much of hustle when you have this standing desk. You're going to be standing straight. The screen is facing up. It's not requiring you to look down. Right? You can exercise. You attend yoga classes with Brother Salman here on Sunday in the morning. You should repeat the exercises at least 3 times a week. Stay hydrated. Limit the use of the phone and the PC after the workout. Also, if you got any stress, according to the literature, it increases the spasms of the neck muscles. But I want you to embrace it. Deal with it. This is how the believers do, right? But if you did all these and still having some problem, so it means that we got some pathology there. This can be muscle strain, it can be degenerative joint disease, cervical disc prolapse, or herniation, or bulging. And then you would have a compression on the spinal cord. You may have a compressed nerve. So the treatments here would be different depending on what is the situation. When you see the primary care doctor, they're going to prescribe or ask you to do x-rays. So if the x-rays show the degenerative joint disease, and then we're going to go conservative. They would have prescribed physical therapy for you. And at this point, okay, we are treating the cause behind the problem, the reason why do you have this problem. So we have to analyze what's going on. We conduct some examination for you. And at this point, I would decide, is it only a muscle issue or it's more than this? So these are the symptoms of the neck pain. These are the common symptoms, but some people would have dizziness, balance issues, bladder and bowel problems, breathing difficulties, and clumsiness. These are the most progressive cases when you have already the spinal cord compressed. So to treat that conservatively, they may have the pain meds, pain medicine specialist. So those people, they would start like prescribing medicines or injections for you. And together with this, we do a lot of stuff, like the manual therapy. You can see in the picture here, I'm treating people, right? Applying some manual therapy for them. We can also increase the neck muscle strength and flexibility. We also apply some sort of biophysical agents helping us to treat the neck pain. We use cervical tractions, we use the TENS unit, and we use the ultrasound waves. So these are options of treatment depending on the case. Dry needling and acupuncture and cupping therapy. These are also things can be used in treatment.
So what about, is it working now? Okay, so now we're talking about the dry needling and acupuncture. So this is beside physical therapy modalities like the biophysical agent, the manual therapy. Also, we have the dry needling in people over age 40. This is a recent study. It's already in 2023, so it's somehow recent. And actually, it showed that in people over 40 years, the research found dry needling was more effective than other traditional therapies like stretching and manual therapy. Overall, dry needling combined with physical therapy was the most effective approach for reducing chronic neck pain. This is based on the recent study in 2023. So dry needling disrupts the dysfunctional motor in the plate, in the muscles, and it's effective for the short-term myofascial pain relief. Also, it helps to reduce stiffness, discomfort in the neck area, and it promotes healing by increasing circulation to the affected muscles. So why do we need the dry needling? To hit the trigger points in the muscle. So something like when we break up the knots, and then we can improve circulation, get the anti-inflammatories, promote healing, and do like tissue regeneration, so that decrease the pain and also improve the muscle flexibility and the range of motion. Another modality, which is the acupuncture. Some people get confused between the acupuncture and the dry needling. The difference is not that big. It just different schools. For the acupuncture, it is traditional Chinese medicine, and they mainly use the interconnected system based on channels, just the open channels, based on energy imbalance, like some blockage. So they believe in openings of the blockages inside the body and do interconnection between the body system, which is already okay. And actually, it's like been now like 100 of years working with this tradition medicine, and it has like good results. So the acupuncture, dry needling, both of them have good results. And actually we use also the electrical stimulation with the acupuncture points in order to help to stimulate the muscle and to stimulate the tissue regeneration. The cupping therapy, one of the traditional methods, and for us as Muslims, we know that there is like hijama. Hijama has also something like suction of the blood and something else, but the cupping therapy may have the same effect, not the same of getting out of the blood, but the same effect of the tissue. So it's a vacuum pressure on the skin that draw out impurities within the deep tissue massage and the muscles. So this suction force expands and breaks open tiny blood vessels under your skin. So when I put the cup, there are like capillaries, some tiny blood vessels. We need to open this, and then it just let's say, when you attract all the impurities, attract all the environmental toxins in one area, and then it can be removed by the lymphatic system, and then it can be replenished again by another new blood flow with new stimulants, new anti-inflammatories, and also new nutrients to the muscles. So it's gonna have like healing at a better level to the cellular area. So here, the cupping can improve, do like myofascial release and also trigger point release, increase circulation, do cell repair, and increase flexibility. This is gonna be like another way of treating our patients besides what we just mentioned with Dr. Khallaf.
All right. Now a question may be raised. So what if I do all this and no results? So the treatment should not end at this point. Most of this is kind of like more of a symptomatic therapy. But the thing is, we need to reset the default from this to this. So we need to recalibrate the brain, resetting, right? So to do this, we need to do a lot of some examination to make sure that everything is okay. So the examination before I go for the examination, I need to tell you that our body depends on the ears, the vision, and the muscles of the neck, and the muscles of the leg, of the feet, to tell the brain, where are we? So if you continue having this posture, it means that the brain receives from these receptors, this is our normal. And over the years, structural changes would happen inside the brain, okay, and confirming this is the normal. How do we know? Which one of those is defective? So simply, we conduct some tests. The first one, when the person is standing with eyes open on a stable surface, it means that we use all the modalities. We use our vision, we use our ears, we use our muscles of the feet, muscles of the neck, to tell the brain what's going on. Once we close the eyes, in the second picture, now we ruled out the eyes. And at this condition, many people, they lose balance. Because now they are dependent on the receptors of the feet and the ears. To make it harder on them, I ask them to stand on a compliant surface, like a foam pad. This foam pad tells the brain that we should not use the feedback coming from the feet, coming from the muscles of the leg. So the brain would tell those, okay, stay aside, okay, I need some other to help me to be oriented about the position of the body in space. So in this condition, the body uses the ears and the vision. And we see a lot of sway happening here. And then the last condition, when we are only dependent on the ears, that's a lot of problems here. People lose balance. They fall. So meaning that our ears are not helping our brain to know where are we. When you have your eyes very engaged in the computer screen or the cell phone screen, so the eyes are now excluded, and you are sitting and you are using your ears only, and we are going there and there and there and no change, and we are not aware about the posture. This is our ears. The ears also control our eyes. So we do another test to make sure that it's one of the ears than the other. So I ask my patient to stand, having the arms outstretched in front with eyes closed, and they step 50 steps. It has to be very quiet room when you do this. And then the results will be positive, and the patient would have a problem with one of the ears if they turn from their position 45 degrees. This is called Fakuda test. Just standing, arms forward, stepping 50 steps, and not the patient counting. I count for them, and by the end of this, the 50 steps, if they are still in their place, that means that they are normal. If they turn more than 45 degrees to this side, so that ear is affected. Right? So we really need to test yourself in this. If you got any rotations more than 45, I got like recently more than like 90 degrees of turn. Some people, they keep going 180 degrees, but this is not the issue here. With the neck problems, it comes like 90 degrees, 70 degrees. right? But with unilateral vestibular dysfunction, this is another issue. It happens and they keep doing it, like keep turning, facing the other way. So now I know that it's the vestibular system. We need to work on those. The last test is to test the position of the head, how you remember your position of the head. So we have a laser beam mounted to the head, and we have this screen in front of the patient, about 90 centimeters away from the patient. And then the patient is asked to, now, this is your normal? Yes. This is your comfortable position? Yes. And then ask them to close their eyes and move the head. If I'm testing the left side, move the head to the left, up and down. And then again, return back to here to the middle with the eyes closed. And I compare the position of the laser pointer at the first, and then when they stop moving. Any change more than 7 centimeters means there is a problem with the proprioceptions of the neck, the deep sensations of the neck. Your muscles are not telling your brain this is wrong. Right? So these are very important examination to be done with any patient with neck pain. And if you have an experience with any physical therapy before that they did all what we have mentioned without coming to these 2 points, it means that they did nothing. You would have the neck pain again. So this is the treatment. So we treat this by moving the eyes first, training them with the laser beams again. And here is this treatment of the vestibular system. How to reset that vestibular system again. How to activate the core muscles to improve the posture. Right? So it has to be something related to the receptors to reset the brain again. If we don't do this, it means all the other modalities that we mentioned, okay, it would not be effective. Because the pain would come again. The idea is the recalibration of the brain. If we do the recalibration, it means that the treatment plan is successful and this pain would not come again. If the treatment plan is missing this part, nothing else is going to be working. Okay? This is what we have prepared for you, and thank you for listening. And we're ready to have any question.
Jazakallah khair, both of you. MashaAllah, this is what we need. What's the cause of vertigo and how that thing happens?
Okay, so vertigo could result in because of many causes behind it. One of them, the positional vertigo, is one of the crystals inside the ear are kind of detached from its position. And it goes to the canals within the vestibular system. And then when you move the head, when you get some position, you start feeling this kind of rotation of the head. So one of them is detached crystal. The vertigo could result from an inflammation within the ear. So we call that labyrinthitis or vestibular neuritis. These are the diagnoses that may result in vertigo. And at this time, the vertigo would last at least 7 to 12 days because of its acute stage. After this, the vertigo would be with the head movement. So with any head movement, you would have this kind of. And at this point, the main reason is the ear is not controlling the eyes. No, this is the third cause behind it. So the third one is having the headache and the vertigo starting here, right, and moving forward. Okay, so there are many, as I mentioned, there are many reasons behind it. The neck muscles, the dizziness that may happen, okay? In some cases, the arthritis of the neck, the decreased blood supply going to the brain stem from the neck is going to be less. And at this point, the patient would feel dizziness once they have the neck extension. It's because of the narrowing of the blood supply going to the brain. So yeah, there are many, many reasons behind it. Yeah.
Any other question?
Assalamu alaikum. Jazakumullah khair. Thank you for the talk. It was very informative. I was just wondering, maybe this is an obvious question, but how much do you see the physical fitness of the patient play a factor in either the ability to treat them or the occurrence of, like, specifically the posture or balance problems in the first place? Like, you know, if the brothers have a bigger, like, belly, is it kind of more difficult, or how does that play in?
Okay, so good question. When we talked about the lower cross syndrome here, so weak abdominal muscles, that's a part of it. When we got that weakness of the muscles, so the lower cross syndrome would start, and then we have the slouching posture and would affect everything, right? But the thing is, again, it's about the receptors that are telling the brain, okay, so I may have weak abdominal muscle, but I may start like tucking my tummy in. So if you tuck your tummy in, means that your chest is going to be up, better breathing, okay? The neck would automatically going back, and the shoulders are back too. So the abdominal muscles, yes, they play an important role in this posture, faulty posture, but they are many layers.
Got it.
Of course, playing sport, playing like doing fitness is helpful, but again, about receptors.
Got it. So it's just one factor.
Yes.
Maybe not.
Yes.
Okay.
It's a factor of those. Yes.
Got it. Thanks.
I can just give you another answer for the same question. For the men who have like a bigger tummy, for the women who have like multiple pregnancy, the weak area in the abdominals, that means that we have weak diaphragm. If we have weak diaphragm, which is the main muscle of breathing, that means we're gonna use the accessory muscles, which are the neck muscles. So using the accessory muscles are not normal for a normal person. So in turn, we will have more spasm, have more overuse to the muscles, and then we're gonna have more stress on the spine, and in advance we'll have like stenosis, spondylosis, whatever. So we're gonna have like the long journey of cervical problems because of the weakness of the diaphragm. So it starts from there and end up there. So that's why also we need to strengthen the abdominal muscles in order to save the neck muscles. Okay. Yeah, so yeah.
Assalamu alaikum. Jazakallah khair for the informative presentation. My question is about the cupping therapy that you presented. Does the insurance cover that? What are the main reasons? I mean, of course it is sunnah, but what are the main reasons people go get that?
All right. So for the insurance purposes, there is no code saying cupping therapy. No, because when we bill the insurance, okay, we say this code for whatever we did. So they know numbers. They don't know like procedures, all right? But we can put it under one of the codes. because these codes are kind of general. When they say manual therapy, what is manual therapy? It includes a lot of things underneath it. Okay, so yes, this can be billed to the insurance, but not under the name of cupping therapy. Yeah. Make sense to you? Yeah.
Assalamu alaikum, brother. Jazakallah khair. I had a question. So, your treatment only covers the neck, or it also will look at the back? Because sciatica will be the back, spondylitis.
Yeah, it can cover both. Yes, with the referrals from doctor would be the best. Yes. Any other questions?
I think we have to mention that also we have like free assessment. So
One more question.
yeah. Okay, I was just gonna say that we have like free assessment, free consultation. So you just can come to our clinic and we can check on you and do the physical exam. And we have the accessibility to do this without referral at the beginning. And then when we find that you guys need to do therapy, so you can do the referral and then come back. But actually, we are totally able to help, like since you just need it. Okay. Yeah.
For evals, yes.
Basically, we wanted to know what is it? Is it like based on the evaluation you do the therapy, or?
Exactly.